Angry customers, patience, that can be a very difficult challenge. And first and foremost, what you have to kind of be able to do is determine, is this a relationship that you can rectify? Is this something where you can get your patient to continue to be a patient or to at least not write a bad Google review? That's the key. If that's the case, then you kind of have to go all in on this situation right here. You have to wine and dine the patient, because many times why patients are mad is because of the fact that they just want to be heard. So let's assume that you have a patient that you believe a situation can be rectified because you didn't blow up their tooth, you didn't do something that is very sketchy, right? It's simply something that they felt finances wasn't good, or maybe even the fact that it was something that went wrong with the treatment that you did, but this is something that you can rectify. So if that's the case, you need to basically hear the patient out, right? They're going to talk and talk about whatever it is that they have going on, and I need you to listen. I need you to agree with them. I hear you. I hear the things that you're saying. You're totally correct. This wasn't right, but this is the key that you have to say to the patient. What can we help do to rectify this situation? That's an absolute must. The reason being is because that kind of puts a pause on everything that the patient is saying. And now, at the end of the day, the tables are on them, right? You put all the balls in their basket and they have to basically say what it is that they're looking for. Because as I mentioned, they want to talk and they want to be heard, just like you do when you're mad. But when somebody asks you, what can we do? Now you need to present some sort of a solution, right? So they'll dive into whatever it is that they ultimately feel they deserve, right? Whatever that may be. Now it's time for you to kind of assess the situation. Is this something that you can do, right? If so, go down that route. Here's another thing that I highly, highly suggest you do for patients that are mad at you, that you believe a situation can be rectified, but even if the situation can't be rectified, give the patient free whitening, right? Free and office whitening. And the reason why I say that is because it's not really that expensive, doesn't really take that much time, but at the same time, patients will appreciate it. But this is where you go a little bit further, because lots of times these patients may not necessarily even want to see you again, the office again, or a situation like that. You let the patient know, I'll give you free whitening, or if you feel this isn't something that you want to do, you can transfer this to a friend or a family member, and I'd be more than happy to do free whitening for them. See, that's the key. I've had a situation like this happen a couple times where a patient didn't want to come to the office anymore. They ended up giving the free whitening to their daughter. Their daughter really loved us. Their daughter started to become a patient of ours. And about 6-7 months later, the mom was like, look, I feel really bad. I kind of want to start coming back to the office because I feel that I did kind of blow things out of proportion. Think about that. That can be the biggest game changer, right? So you've done that. What else can you do? A handwritten card of essentially kind of an apology that things didn't go the way that you wanted them to go. I hope you give us another chance. But in that card, I want you to write about the whitening, whether they can do it or a friend or a family member that they can transfer that to. Include that in the apology card as well. I'm telling you, when you go down the route of something like this, that's going to be a very, very big game changer for your patients, because people want to be heard just like you do. When you're not feeling too good about a situation, you want to complain, you want to just vent, you want to get things off your chest. But when somebody goes above and beyond to offer something like this, even though the situation may have soured, you kind of remember in your scenarios where bad things happen and you didn't like the outcome, you remember those types of people a little bit more than when a situation went south and nobody did anything to try to rectify the situation and basically just said, screw you, I don't like this. this situation, right? Think about that. You can rectify things, and at the very least, you can prevent a bad review or somebody talking bad about you. Because even though a situation went bad, people are not really going to talk bad about you or spread bad words about your practice or the way that you do dentistry if you try to go above and beyond, right? That's just how human nature works. So keep that in mind and try that out. Hopefully it doesn't have to happen too often, but try that out if that is a situation that you encounter once or twice.